Good morning, everyone, and welcome back to Barnstable this morning. Just about 20 minutes toward the top of the hour. I'm Sarah Colvin, and joining me live on the phone, I welcome our Cape and Island State Senator, Dan Wolf. Senator Wolf, good morning.
Good morning, Sarah. How are you?
I'm doing well, thank you, and yourself?
It's amazing winter so far, that's for sure.
Absolutely. I think, we've still many months to come, but I'll take this warm weather for sure. This is going to be our last conversation of 2015, and I think it's fitting that we're talking about this issue because it really has come to the forefront and been one of the most pervasive issues of the year, and that, of course, is the heroin epidemic, the substance abuse issues that we are seeing, really blaze through our community.
Oh yeah, I mean an epidemic is an understatement. I mean it's the impact that it's having, and the depth that it's going into our communities, and the social and economic consequences are really overwhelming.
So last Thursday was really, I hate to say the word pleased, but I was pleased to see so many people in attendance, standing room only, a full house at the Tilden Arts Center at Cape Cod Community College for the premiere of the HBO documentary Heroine Cape Cod. And I have to say, I went in there a little skeptical as to what kind of an image it was going to give of Cape Cod, but I came out of there with a full range of emotions. And it really did do a lot to kind of change my mind about the issue, which was surprising to me. Tell me a little bit about your impressions.
Yeah, and not only were there 700 people there, but we had a wait list of 400 that couldn't get in. So given that the little promotion we did and the amount of interest there was, it really does speak to how important an issue this is for people. What this documentary did is it really put names and faces to all the statistics that we keep reading about and hearing about. Statistics like, for example, 5% of the world's population in the United States is using 80% of the opioids that are produced. 99% of the Vicodin, for example, are used in this country. Again, 5% of the world's population. So it really it brought it home because of the heroin epidemic that's out there, and people like to talk about gateway drugs being marijuana or alcohol. 80% of the heroin addicts, and Cape Cod is no exception, 80% of the heroin addicts are starting with legal prescribed drugs that have flooded our society. And if we want to attack this problem, the place to start is the gateway, and that's the legal prescribed opioid.
Absolutely, and that certainly was something that we saw as a part of that documentary with several of the young people who were profiled. And I think for people who haven't seen it, of course, it's going to premiere on the HBO channel on the 28th. But it follows the lives of, I believe it's 8 young people, mostly from Falmouth, who are suffering from opiate addiction. Some of them actually passed away due to their issues before the film was completed. But certainly hearing the stories and actually being able to see the kids come up on stage afterwards was really powerful. To hear them talk about how, they got into a motorcycle accident or were hit by a drug driver or prescribed this medication, and then it just completely changed their lives and not for the better.
Yeah, the stereotype is that, a kid goes to a party when they're 14 and either takes a drink of alcohol or a puff of a marijuana cigarette, and then it ends up being a heroin addict. This really defies that. These are kids who, as you said, a motorcycle accident or a sports injury, a prescribed opioid leading to heroin addiction. That is the pathway now. That's really the scourge that we're trying to fight. And, you and I have talked about the legislation that I filed. Among other things that we can do is hold pharmaceutical companies accountable for this and really look at the chain of prescription, the healthcare providers right through to the doctors and the whole medical establishment. There is, I think, both culpable but also an opportunity to ascribe responsibility and then look for resources to help prevent and treat the problem.
Absolutely. So I want to talk a little bit about the legislation in a moment, but really I want to talk, to start as, again, we were talking about the documentary and the takeaway for you. Obviously, there was a Q&A from the audience that was part of that experience. For you, what did you take away from that event and seeing such a large community response? I think that we're going to see some steps being taken following that.
Well, first of all, there was a visceral reaction about why was this thing called Heroine Cape Cod. It could have been Heroin Anywhere USA. And I think the documentary producer, by the way, he's an Academy Award-winning documentary maker. This guy knows what he's doing. Decided on that because he wanted really to make the point that people look at an idyllic place like Cape Cod and think we're immune to these problems. So it really gets your attention. Heroine Cape Cod almost seems like an oxymoron. But what this did is, because it put a name and a face on the problem, it really drew people in emotionally. And really, I think, it cries out for action. And I think the great thing about the Q&A afterwards is people were really focused on, well, what can we do? This is a huge issue. What can we as individual citizens do? And, one of the points I made was we can elect people who are willing to speak truth to power and take on the pharmaceutical companies and take on the providers and the prescribers and make sure that we're not doing this over and over again. And Sarah, to draw us back up to 50,000 feet, let me just make some other parallels. We have a food industry that floods the market with sugar and unhealthy products, and lo and behold, we have an obesity and a diabetes problem. We have gun manufacturers who flood the United States with guns. Lo and behold, we have a gun violence problem. We have opioid manufacturers that flood our society unabated, without restriction, with opioid drugs, and we have a addiction epidemic. How many times do we have to see these kinds of things repeated before we understand that the role of government is actually to protect and regulate our citizens from those interests that would exploit and make money off it? And that's exactly what our pharmaceuticals are doing right now. They're making money off of an epidemic that is having incredibly bad consequences on the communities that we live in.
And I think it's pretty obvious to see the impact that the overprescribing of opiates is having. I mean, I think there's no question that there's a tie there. So as you say, let's talk about what's next. So tell me a little bit about what you're working on, Dan, to try to combat this.
So a big picture, okay, the Senate already passed an opioid bill. I know we sent you yesterday a summary of the bill, so you've got that in front of you.
Do.
Which really looks at how do we do prevention programs. Most importantly, how do we expand the capacity for treatment? Although I would like to see us focus more on prevention, it does give more resources towards treatment. The governor's got a bill out there which has some really good stuff in it, which would limit and restrict how these drugs are prescribed. And instead of sending people home with hundreds of pills, say, look, we're going to send you home with a number of days' worth, and then we're going to ask that you come back and consult with your doctor and really understand, A, the nature of these pills and how addictive they are, and B, really assess whether you need them going forward. So there's a couple of good bills out there. I had an amendment on the Senate bill, which would move us a step forward to a mandatory buyback program, such that the people who are the entities, the pharmaceuticals that are manufacturing these pills, instead of just increasing their profit by having all these pills out there, would actually be forced to take them back and buy them back, and the money and revenue from that would go into prevention and treatment programs. Just as a statistic, 58% of the opioids that are manufactured right now are being used for the purposes for which they're being manufactured, which means that 42% of the drugs that are being pumped out by these pharmaceutical companies and prescribed, 42% of them are either being flushed down the toilet or, even worse, being used to create the addiction problem that we're talking about. So my amendment would at least create a mechanism to A, generate revenue, and B, get those pills out of circulation. So there's a lot of creative ideas, but when it comes down to it, if we have pharmaceutical companies that are buying politicians by making contributions and by lobbying, as you've seen in other sectors of the economy, we're not going to get our arms around it unless people are willing to take tough votes and unless voters are really willing to hold elected officials accountable.
Indeed, and I think, education is really going to have to play a large part into this as well. I think that, while there's no question that the opiates are addictive, I feel that there are a lot of misconceptions out there of addiction as a disease or how you become addicted. I think that there's a lot of people who think that, people just pop pills for the fun of it, when really the science is there to prove that taking opiates over time, it changes your brain, and it starts to drive you as opposed to you driving it. And I think that's a big part of the educational component that needs to get out there to help change people's minds.
It's a physiological addiction. You're absolutely right. It's a chemical addiction. It's not a sign of weakness. It is an illness. It's a sickness. And the best way to deal with it is to prevent it. We are also a society where we want to prevent anybody from feeling any pain. The reality is a lot of people do need drugs like this because they have chronic pain issues. On the other hand, before we had opioids, people would have surgery, but they would go home. There would be much less powerful drugs they would take to manage the pain. And, I hate to say this, but they would suffer pain for a few days. I mean, the idea that, you're going to have a medical procedure or you're going to have an injury and there's not going to be any pain is not an idea that I grew up with. I mean, you have injuries and you have situations where you're going to have some pain. And part of the balance here is to make sure that we don't create a society where people feel like any pain is not tolerable. I mean, we can endure it, and if the trade-off is we're going to eliminate all pain, but we're going to have a society that's addicted to pharmaceuticals, I know which choice I would make.
Absolutely, and I think a couple of days of pain is certainly a little more tolerable than a lifetime of addiction.
And it is a lifetime. I mean, what you said before is absolutely right. Once you're addicted, and once those chemical changes have happened, it is a lifetime issue that has to be dealt with. It doesn't just go away and life returns to normal. And that's really one of the most challenging and difficult parts of this. And again, the movie really drove that home, that we're creating a whole culture now of addiction and that we're going to have to deal with for at least a or two generations, even if we get our arms around it.
So what are you hoping for, Senator Wolf, in the coming months? What are you hoping for in the next year when it comes to dealing with this issue?
Well, first and foremost, there's some really good legislation. The Senate has some really good aspects in its bill. The governor's bill has some good things. The House has yet to act, but I'm sure that they will because there's a real focus and spotlight on this now. So what I'm hoping is in Massachusetts, as we have in other issues, that we show real leadership. We get our arms around prevention and we start having the discussion with our kids in the schools at an early age. Because again, prevention is really the key here. But then we allocate the resources into programs that we know work. One of the things that came out, Sarah, is we know that the 3 to 7 day inpatient is simply not enough to deal with the severity of this. So we're looking at ways to expand treatment programs and put the resources to it. Again, my bill would create a mechanism to collect resources from the pharmaceuticals. So I'm going to keep working on that one.
Indeed.
Go ahead.
If I may, just thinking about treatment, from what I understand, it's something that right now insurance just does not pay for. And I think that is something, too, that's going to have to be taken a look at in the coming year, in the coming months, to see how that can change. Because it's an astronomical expense. Rehab is extraordinarily expensive and not covered by insurance at this point in time.
Well, it's pay me now or pay me later, right? Because,
right.
One of the statistics I'm sure you noticed on that film was that 80% of the crimes being committed on Cape Cod right now are opioid related. 80% are opioid related. So we could choose not to ask these insurance companies or force the insurance companies to pay for longer term treatment because that's what we know works. But if we don't force them to do that, we're going to be paying through other ways. If nothing else, they're going to have to keep coming back to treatments that aren't effective. If somebody gets a 28-day, which is more effective, that's better than 4 or 7 days that aren't effective. And I think, as we learn more, we're going to be able to allocate resources in the direction where we know that there are effective ways to do this.
For sure. Well, Senator, I thank you so much for your attention to this matter, and certainly, thank the entire Cape delegation for being present last week. And, again, looking forward to seeing how we, as not only legislators, but as a community, work to solve the problem.
Yeah, it's going to be interesting, Sarah, to see the reaction when this gets out into it's the 28th of December on HBO, and it will be interesting to see what the general reaction is once this HBO film runs, because it could be anywhere USA, but this is our backyard, and it certainly is Cape Cod, USA, in this case.
Indeed. Well, Senator, I thank you so much, as always, for joining us, and Merry Christmas, Happy New Year, Happy Holidays to you and your family, and we will talk with you again in 2016.
Great. Have a great Christmas and New Year, Sarah. We'll talk to you. Thanks.
Thank you so much. Bye-bye.
Bye.
Cape and Island State Senator Dan Wolf joining us here on Barnstable this morning. Rob Keane is next.